Hi, everybody. This is Leslie, and you're listening to the interview with Leslie Heaney. This is part 2 of my episode with Dr. Kellyann Niotis. As I mentioned, June is Alzheimer's and Brain Awareness Month, and Dr. Niotis is a true expert in the space of neurodegenerative diseases and what we can do to hopefully prevent them and reduce our risk. In part 2 of this episode, we talk about the modifiable risk factors for dementia, meaning risk factors that you can actually modify or reduce. And they could be everything from controlling your cholesterol to getting the shingles vaccine. It's really such a fascinating conversation and really gives all of us the information that you need to make better decisions and to take control of your healthcare to ensure that hopefully you do not develop Alzheimer's, Lew body, or Parkinson's. A really great conversation. But before we get to part 2 of this episode with Dr. Niotis, just a few words from me about our sponsor. I'm so excited about this week's sponsor, the TENMILE Distillery. TENMILE is an American single malt distillery based in the Hudson Valley, about 90 miles north of New York, and it is the maker of the award-winning Little Rest whiskey, made through a slow distillation process with all New York State grains by master distiller Shane Fraser from Scotland. And when I say award-winning, I mean it's earned a 95 out at the whiskey competition in San Francisco and a 96 at the New York International Spirits Competition. This is delicious. If you do not believe me about how delicious this is, the good news for you is that if you're in the New York area, you can go visit this incredible and beautiful distillery yourself. It's set among the most beautiful apple orchard with beautiful views of the mountains behind. Stop by for a leisurely tour or tasting, or even enjoy an expertly crafted cocktail. They also have gin and vodka available. They also have this incredibly delicious Thai restaurant that is in residence there from Thursday through Sunday. To learn more about the distillery, you can visit them at tenmiledistillery.com/theinterview. I should also mention that in honor of Father's Day, all orders made from today through next Wednesday, June 18th, will receive 10% off if you put in promo code The Interview at checkout. So go to www.tenmiledistillery.com/theinterview to get that discount, that 10% off. I promise you will not be disappointed. So thank you again to TENMILE. And with that, here is Dr. Kellyann Niotis. Whether you test positive for the 3 or the 4, right? Or you don't test positive, but you have family history, or you're just concerned, or you just want to reduce your risk. Can we talk about, this is your area of expertise, right?
This is what I do.
This is what you do, which again, as I mentioned to you before we started, is just so, it's just so important what you're doing and so impactful, because giving people, my mother-in-law, as I mentioned to you, had dementia, and she, by the time she was formally diagnosed, she was sort of too far along for there to be any steps that she could take to reduce her, to sort of mitigate her symptoms and allow her to have a different outcome than she had. So it's just so empowering to be able to say to people, even if you have these genes or you are empowered, you can be proactive to tell your story in a different way, to have a different outcome.
For sure. I mean, knowledge really is power. So the first thing, and one big key takeaway for the listeners tuning in is really understand your family history. You cannot fight what you don't know you're up against. So ask your relatives what diseases they came down with, or family members had, what the age of onset was, what their symptoms were. It is, as I mentioned, Alzheimer's disease is the most common form of dementia. So it is really common for a loved one to be diagnosed with just like standard unspecified dementia,
right,
or Alzheimer's disease. But if you listen to the symptoms, you start to uncover that, they also had a tremor, probably wasn't just Alzheimer's disease. So really understand what symptoms they had and also what other diseases they had. Did they have sleep apnea? Did they have a lot of head injuries? Right. Did they have a very stressed life? Were they really anxious? Did they have trauma in their life? All of those things impact one's risk. So understanding, and the best look at yourself is through your family. Like those are the most direct the best mirror into what your future is. So understanding what risks and medical conditions they had can help you try to remove those potential contributors to disease in yourself.
Tell us what those things are.
Yeah. So, and I've spoken about this extensively. I love lecturing doctors and other medical providers about this. There are 14 fully established modifiable risk factors for dementia. I believe there are more than what is formally established, but we can talk about some of those. We already mentioned high cholesterol. That's a big one. That's really big for people who carry this ApoE4 gene. Treating cholesterol early, and there's a lot of hesitancy about treatment of cholesterol and taking pills and like what to do.
I have a very, very close friend has high cholesterol and doesn't want to take
any medications.
The cholesterol medication. And
you know,
I'm going to send this episode. Would you just explain like why taking the pills are important?
Yeah. So, you know, diet and exercise.
Like Lipitor and those sorts of pills. Yeah.
Diet and exercise can only go so far, especially in people who have genetic predispositions to have high cholesterol. Your body's handling it differently than somebody else. And you can eat the best possible diet and still have issues with your cholesterol. So at this point, you know, we have to acknowledge that thankfully we have medicines that can help us overcome what we cannot overcome ourselves. And these medicines are safe and they work really, really well. There are lots of options available. I shouldn't say lots, but several options available for treatment of cholesterol. And it really depends on what we see in your blood for what medication we may want to put you on first. Things like statin medications work well in some people and not so well in other people. Zetia or ezetimibe is another big one that blocks cholesterol absorption. There are now injectable versions called PCSK9 inhibitors, so there's lots of options available. So one common situation that people will bring up to me or patients will mention is, you know, well, I do have like slightly high cholesterol, but I did a heart scan or a coronary calcium scan looking at plaque buildup in my heart, and I don't have any. And we don't see any evidence that the cholesterol is causing any harm in my brain. So, like, why should I treat it? Like now, or why should I treat it, period? And, you know, that's the whole point of prevention. Like, yes, we found this risk factor. And if we don't want it to cause problems later, let's intervene on it now. Let's not wait until it causes plaque buildup in your heart or your brain. We know that eventually that's going to happen.
Right.
So let's
So what you're saying is when they do, because I've had the sono and whatever this vein is.
Carotid.
The carotid artery, right? And that might have even been my friend's defense, was that, you know, those things were clear.
It's always the defense.
But your point is that eventually it's not going to be clear. And in the meantime, it's doing this cholesterol dance with the cells in your brain. So you want to forget about the cardiovascular risk factors by having the high cholesterol, but it's also your brain's health in the meantime too.
Yeah. Along the lines of cardiovascular disease risk factors, we have things like high blood pressure, also too low blood pressure. You really want your blood pressure in a nice optimal range. You want the top number somewhere between 90 and 120, somewhere between there. Systolic blood pressure, the top number is really the big one for brain health, although the bottom number is also important, a little less studied. So monitoring your blood pressure at home, a lot of times your doctor will check your blood pressure once a year, and when you go into your doctor's office, you're flustered or nervous. It's really common to not have a very accurate blood pressure recording. So I always recommend people buying their own blood pressure cuff and just checking their blood pressure when they're at home in their own environment and feel comfortable, because that's when you're going to get the most accurate measurements. And blood pressure can fluctuate. So you might wake up and your blood pressure is normal, but by the end of the day, your blood pressure is high. And there are certain medications that we can use that are shorter acting that we may want to use later in the day if your blood pressure tends to run high later in the day and so forth. So high blood pressure, another easy one that we can take care of without issues. And too low blood pressure. If you have too low blood pressure, you should really see somebody, especially if you're having symptoms including dizziness, especially lightheadedness when you're standing up. That's essentially your brain not getting enough blood flow.
Oh, interesting.
Which you can imagine how that could cause issues.
Yes.
And that's really common, especially in the elderly, to have that issue. Insulin resistance or diabetes is another big one.
Okay.
So watching how much sugar you're taking in, refined sugars, processed carbohydrates, anything that's going to cause glucose spikes is going to contribute to poor health collectively, but also poor brain health. And, the test, unfortunately, that we check for diabetes is not the most sensitive for the earliest signs of diabetes. So it can often miss people who have this more pre-diabetes stage or just the earliest signs of insulin resistance. Most insulin resistance really comes from our diet and our body composition, although there is a lot of genetic predispositions that put people at risk to develop this.
2 follow-up questions to that. One is, what about things like Ozempic and what's the name for them? The
GLP-1.
GLP-1, but what is the street name? The semaglutide.
Yes. Generic.
Okay, generic. Yes, the semaglutides. That is leveling your blood sugar. Are you seeing? Is there any research to showing that might actually be a positive?
Yeah.
Second question along those same lines is those monitors that check your blood sugar spiking.
Yeah.
So having your blood sugar be level, is that should be a goal? I know that people talk about that for just sort of overall health, but is it also something that you want to be mindful for? No pun intended on the on the brain front too.
Yes, for sure. So glucose variability.
Okay.
So the differences in how high you're spiking and your lows is kind of what you're saying. We want it to be very level. I think, a continuous glucose monitor, wearing something on your arm or belly can be very helpful for some people if they're very data driven. It can also be just helpful because you just don't know how your body would respond to certain foods. So it could be very educational for some people. But again, not all tools work for everybody. I'm not saying everyone should wear it, but it can be helpful for some people, especially if they're really trying to figure out where to go with their diet and they're really not sure. To go back to your question about the GLP-1 receptor agonists, so lots of science is evolving in this space. These drugs hold so much promise for a lot of different health conditions. In my world, a lot of promise for neurodegenerative diseases, and whether that's related to the way that they affect peripheral levels of glucose and peripheral insulin signaling, which we understand is a risk factor, or if that relates to the way they change insulin signaling in the brain or have other downstream effects in terms of inflammation. We don't fully know. We do see, and in the research that I do through the Institute for Neurodegenerative Diseases, which is in Boca, we are studying a lot of different pharmacological interventions and its impact or their impact on blood-based biomarkers for neurodegenerative diseases. And when used in the right person at the right dose, carefully monitoring things like their body composition, because we don't want them to risk losing too much muscle mass. There are downstream harms that can come from using these medications, so they have to really be used carefully. But when used carefully in the right person, we've actually been seeing really promising results in terms of their impact on neurodegenerative disease pathology, specifically tau pathology. And this has been shown also in other research sites or through other research studies that these medications seem to change the way these toxic proteins can accumulate and form in the brain. And they reduce the accumulation of these tau proteins, which can be problematic for Alzheimer's disease.
Wow, interesting. So one question about that too, sorry, and don't let me go too far off piece, but we talked about the genes. Mm-hmm. You were just talking about these other proteins. Are there certain proteins like in people's blood that you can measure to see if they have a higher risk for Alzheimer's or Parkinson's or Lew body?
Yeah, there sure are.
Okay.
More so along the Alzheimer's and Lewy body spectrum.
Okay.
Less is known about blood tests for Parkinson's disease, although lots of people are working on them. There's nothing that's really, really, really reliable right now. But yes, we can test for amyloid proteins in the blood. We can test for different forms of tau proteins in the blood.
Now, would you want to do that blood test instead of doing the genetic testing? So you don't have the insurance risk, you don't have that fear, but you actually are looking to say, okay, because wouldn't you need to have those?
You still have the insurance risk because these are clinical tests.
Okay, so it's not like the gene's not necessarily being triggered unless you wouldn't see that it's being triggered unless you had these particular proteins. Or is there no correlation necessarily?
No, there is.
Okay.
There is a correlation between the proteins and having the gene. We do know that, of course, just based on what the gene does, that people with...
I'm just trying to get away from having your life insurance canceled.
Yeah, I know. Everyone's trying to. There's no way. They will get you.
Okay, just
they want to find
can we
you.
just test for these proteins and not find out that you have a 4 or 3?
No, because they're clinical tests. I mean, we do a lot of research, so there's ways to get the tests through research protocols, and in those situations, then it's of course not a part of your health record because it's research. But for most people, places like LabCorp will test them. I think the panel is somewhere around $800 or give or take, and you can get them tested yourself and learn about whether or not you have high levels of these proteins in your blood.
But you would need a doctor who knows how to translate what that means.
Yeah,
and that might not necessarily be your general practitioner.
That probably is not your general practitioner.
If people wanted to look to see if they had higher levels of these proteins, that might mean that they're at higher risk of an Alzheimer's, and also are biomarkers that you can then, because this is your area of specialty, based on changes in your lifestyle, actually see these proteins decrease, right?
We have seen that.
So who do you go to have besides you?
I know. It is an impossible feat, unfortunately, at this point in time. A couple of months ago, there was this article written in Neurology Today, which really got under my skin. It was 2 working groups that were talking about, the advent of these blood biomarkers and what they mean and whether or not neurologists should be testing or offering patients these tests. And the consensus among these working groups was that no, we should not be testing these proteins in people because we are causing unnecessary worry and there's, quote, nothing that we can do about it. And, to hear that again in 2025 is a little heartbreaking because we do know that 45% of dementia is preventable, 45%. And, maybe they mean that there aren't cures for Alzheimer's disease, and that might be true, but to say that there's nothing that we can do about it, well, that's just frankly not true.
Right.
We're talking about all the things that we can do about it now, and these things are pharmacological and lifestyle based. I would say treating your cholesterol is something that you can do about
100%.
it. And to have the opportunity to actually monitor these biomarkers on an individual level, because like I said, there's no one size fits all. This is all pretty personal. What works for one person, what medication works for one person might not work for another. For example, we mentioned these GLP-1 drugs, and there's some evidence that they may benefit Parkinson's disease, and then some studies that show that they may not do anything, or maybe even lower dopamine levels, which may be harmful or maybe not harmful. We don't know.
Right.
But to be able to really in real time monitor in a given person, like what a statin is doing or what a GLP-1 is doing to these biomarkers, is such a powerful way to actually make progress. Unfortunately, it's going to take the field of neurology a long time to really get there, and there are very, very few providers that are doing it.
So you and I got connected through a mutual friend and also a patient of yours who did have some of these protein markers, does have, I think she's a 4, has one of these genes.
ApoE4, yep.
And through working with you has reduced those proteins and reduced her risk. So, and CNN you just were featured on CNN, you both just co-wrote this article together. So I want to get to that because I think it's so empowering for people listening, after we've just really, at least for me, bummed everybody out. I'm going to go, I want to get tested, but I'm scared I'm going to get dropped by my life insurance company. But that there are things that we can do. And if you do these things and you are proactive, you can kind of take control over your health and your risk of developing some of these neurodegenerative diseases. Okay, so
let's talk about some more.
Alcohol, diet, and you mentioned muscle mass. I want to talk about that.
Yeah.
So
alcohol, there are people out there who will say all alcohol is toxic. And, it is probably true that alcohol is a toxin. It's a neurotoxin. We know high excess alcohol use is one of these risk factors for dementia. Maybe Parkinson's too, less is known there.
Is that because of sort of the link between alcohol and inflammation and sugar, or?
It is directly toxic to brain cells.
Okay.
So it is.
Right. It's like your brain on drugs. It's the killing brain cells. Okay.
It is directly toxic.
Okay.
Like I said, I posted this picture of a brain on social media of a 72-year-old woman who abused alcohol compared to a 72-year-old woman who did not use alcohol. And it's pretty startling how much brain atrophy there is there. So yeah, excessive alcohol. And for women, that is defined as more than one drink a day, which is, that's a lot of alcohol.
Yeah.
I'm not saying that, you should never drink alcohol. Definitely, it's okay. You can indulge.
I actually have a girls' night tonight. I'm in just for the night, so I might have to revisit that fact tomorrow. But I've got to.
You have to balance it with the other important modifiable risk, which is the risk of social isolation and loneliness. Right. Alcohol is often, in our culture at least, something that you enjoy in a social setting.
Right.
And it's important to make that distinction between when you're enjoying alcohol socially and potentially when you're maybe just using it for treatment of your stress and anxiety and having some wine alone at home. Like, that's probably not the healthiest use of the alcohol. So just really evaluate the way that you're using alcohol. I have said before, I recognize that alcohol is a risk. I enjoy alcohol socially. Yeah. I try to limit the amount that I drink, but it's not that you can't ever drink. It's just really be mindful of the occasions that you're consuming alcohol. And this might be less relevant for future generations as I think the younger generations are drinking a lot less.
And they're smoking pot or doing gummies and stuff.
Edibles all the time.
What about that? What about THC?
Good question.
It's just there's not enough research there
Well, the research that we have is, so most of the way that THC was consumed was through inhalation, which is a little bit different than eating it. So we don't actually have a whole lot on the effects of THC that's consumed through consumption.
Okay. In terms of brain or increasing your risk for any of these disorders?
Well, what we do know is, of course, in the short term, THC is going to impact your cognition, and the effects of that can last a couple of days. Fortunately, that seems reversible. So if you stop using THC, you should recover your brain function. If used early in adolescence, there was actually a study that showed brain structure changes.
Oh, right.
So it probably matters when the consumption started. Anything that you start while your brain is still developing is going to have much more profound impacts on you later in life versus when you're a child or when you're an adult.
Okay. Well, you talked about muscle mass from the semaglutides being of concern, and the link there with muscle mass and neurodegenerative disorders. So talk about that and lifting weights and the importance of that and how often.
So obesity is obviously recognized as a risk factor for our health. Collectively, we know that it increases risk for heart disease. We understand that it is a modifiable risk factor for dementia. What is less spoken about is the risk of sarcopenia, which is age-related decline in muscle mass and strength. Everyone's muscle mass will start to decline naturally as we get older. What's extremely problematic is when obesity is combined with sarcopenia and it leads to sarcobesity. That is doubly bad.
That sounds like that could be like a summer horror blockbuster, sarcobesity.
Sarcobesity. You don't want sarcobesity. Okay. And unfortunately, a lot of people who are using GLP-1 drugs are developing sarcobesity because they're losing muscle mass and
gaining fat.
and unfortunately, disproportionately losing muscle mass compared to fat. So at the end of the day, they have a really problematic body composition profile. And we understand that there's a huge link between sarcopenia and risk for neurodegenerative disease, but more so sarcobesity. That's doubly bad.
Interesting. So for people like obesity, would that be like your body mass index is 25% fat or more? Or 30? Where should people, what's a healthy range?
Yeah. So
and then for the should people have their muscle mass tested? And then just like we talk about the ways you can reverse, these proteins in your blood, is this one of the ways, like actually looking to see what your muscle mass is and working to build that to get to a healthy level?
So unquestionably, obesity and managing obesity is the Lancet recognizes it as a modifiable risk factor. Sarcopenia, sarcobesity, not recognized yet. I personally believe they're risk factors. There's definitely studies that show that they're harmful for overall brain health. One day, hopefully, they'll be added to this list of 14 that the Lancet has published in 2024. But I try to stay away from using BMI as the definition for obesity.
Interesting. Okay.
Really, I like to say monitor your waist, not your weight, because it's really waist circumference that is...
Is that because of visceral fat?
It's because of visceral fat.
Okay.
Because the fat that's in your abdominal region, the fat that's around the organs, is metabolically different than the fat that accumulates subcutaneously or under the skin in our arms and legs. Although aesthetically, we don't like to see fat there.
Yeah.
Really, the problem is the fat that is centrally, because that's really pro-inflammatory. And it's very difficult based on BMI to understand that metric.
I see.
So I really shy away from using BMI as kind of like a mental cutoff for obesity. There are lots of ways that you can rudimentary test your body composition. There are certain scales that you can purchase that have varying degrees of accuracy that'll give you a muscle mass composition and body fat composition. Those kind of are variable depending on your hydration status. You can get a DEXA scan with body composition.
Yes.
Those are actually pretty widespread now. They don't cost a whole lot of money.
And when you get a DEXA scan or something like that, are you going to get the information? Will someone tell you? Obviously, someone needs to be, have some expertise and being able to guide you and explain to you what the results mean. But would they say to you, like, your muscle mass isn't where it should be? You need to gain 10% more muscle, and we're going to come track it, and we're going to look at you again in 6 months, and give you some action steps you can take away from that kind of a test?
Well, it's always helpful to be working with someone who could kind of give you more targeted advice. But depending on where you get the DEXA scan, they usually give you percentiles. So you'll know where your, for example, appendicular lean muscle mass index is. That's the muscle in your arms and legs.
Okay.
That's a really good surrogate for total muscle mass. It'll tell you.
Yeah, I've had those pincers done to me. It's a real eye opener.
Yeah,
and I always get the
know.
arm, and
But it'll tell you where you are percentile wise.
Okay.
And sarcopenia, and don't quote me, but I think it's an ALMI of 5.7. I'd have to look that up, but you can kind of see how close you are to that. And then they give you percentiles for body fat and so forth. So, it takes a long time to change your body composition. 6 to 12 months is really, closer to 12 months is probably how frequently you should check it. I do like the home scales after you have had a DEXA, because while they may not be the most accurate, they do help you with trends and trajectory. So for our patient that we alluded to, I had her get a home scale that measured body composition, because we did put her on a GLP-1 agonist because she had excessive amounts of body fat that really needed to come off. It was metabolically unhealthy for her. We did so carefully with measuring her muscle mass every week, body fat every week, and we really dosed her based on what we were seeing, and she was very, very dedicated to muscle building. She's one of the very few people that ended up putting on muscle mass on one of these drugs. So she's a special case.
And part of that too, from what I've read and understand, and this is also important for women who are, menopausal or perimenopausal, is eating enough protein.
Absolutely.
And it's actually like an absurd amount of protein.
Especially as we get older. It is an absurd amount of protein.
Yeah. And I don't even know how you
can do that.
Yeah. And without doing protein shakes or things like that.
Absolutely.
Besides the risk factors that things we want to avoid or be mindful of, like what proactively should we be doing to protect our brain?
So
you said sleep, I know, is one.
Yeah. Well, 3 very easy ones that everyone listening should do, because if, they're so easy and it's silly to not do them. Get a hearing test. Screen yourself for hearing loss. That is one of the biggest modifiable risk factors for dementia. And we do recognize that wearing hearing aids mitigates that risk. So easy. You have hearing loss, get hearing aids.
Wait a minute. Seriously?
Seriously.
Because if you're not hearing, it's actually affecting your I mean, I know it affects your ability to understand people around you and what's going on, but I never thought about the effects to your brain by you not being able to hear what's going on. Interesting.
I mean, just how these things are all so tied together. Of course, hearing loss, you're at risk of social isolation.
Right.
You can't hear, can't follow conversations, but hearing is processed in the region of the brain that's impacted by Alzheimer's disease. It's processed in the temporal lobe. And I always like to say the brain is a use it or lose it organ. It's the best way to understand this. So the brain needs sensory inputs to stay active and healthy.
Okay.
And hearing is a major source of sensory.
I'm sending this to my father, who will be 86 this month. And, his hearing's not great. He refuses to wear a hearing aid because he sees it as like a sign of weakness. But
I know.
Now they're like
so small, so
tiny,
discreet.
Tiny. Yeah.
The vanity concerns are real. I get that. And it is annoying. It's annoying to have to think about it and take it out anytime you're in the water. So I get it. But the impacts on your long-term brain health are so worth it.
Okay. And the same thing for eyesight.
Yeah. So vision, that's the other, like we said, there are 3 really easy ones that everyone should do. And it's stupid to not do. Screen for hearing loss, screen for vision loss. Any visual impairment should be really treated early. That's a new modifiable risk factor according to the Lancet as of 2024. I recognize that as a risk factor for a long time.
These are my Amazon size 2 readers. I think I might be going up. I need to get another eye check. Very important, because I didn't think about it with the links between your eyesight and your brain. So,
and I really think that one's super important for Lewy body and Parkinson's disease as well, because part of what is impacted in those particular diseases is a part of the brain where vision is processed. So really get your vision checked. And then the third so easy one is wear a seatbelt and wear a helmet. Head injury is a huge risk factor for all neurodegenerative diseases. I can't tell you how many times I've heard the same story from a family member who would say, my mom was okay, and then she had a pretty significant fall. And then
what
her
about
symptoms.
Concussions? Younger people who get a lot of concussions, are they at a higher risk of developing?
Yes. Okay. Yes. So even a mild head injury can increase your risk, and the more head injuries you have, the higher your risk gets.
Okay.
Of course, we can't undo the damage from your past concussions. There are things that, of course, levers we can pull and try to modify all the other risks that we can, but not developing another concussion is huge. So if you partake in high-risk sports like skiing, snowboarding, even surfing, you could get hit on the head. I know it's not cool to wear a helmet, but it's important.
Okay, interesting. Okay. And then sleep, how many hours do we need?
Yeah, sleep's another big one. And, there was also a very interesting study. Exercise is huge, of course, and we can talk about that forever, but there was a very interesting study that mentioned that if you exercise, if you haven't slept well, you negate all of the benefits of exercise. So always prioritize sleep before exercise if you haven't been sleeping well.
And does everyone have their optimal number of hours? Like I would say 7 to 8, but it might be. I just saw Rob Lowe interviewed on the Today Show. His number is 9.5 hours, and he looks great. So is it just? It depends on who you are.
It's variable, and you should just base it on how you feel after that many hours, right? If you wake up after 7 hours and you don't feel refreshed, then you probably need some more sleep.
I see. Okay.
So it is
Just like that's just
logic.
Know,
it's just logic.
Okay.
It's kind of common sense, but there isn't like a perfect number. What we do know is that sleeping less than 6 hours seems to be problematic. And maybe there are rare exceptions where people can get away with sleeping less than 6 hours, but that doesn't seem good for a long-term health period, mortality risk period, but also not good for long-term brain health.
So the things that you've mentioned to protect brain health, right? We just talked about sleep, getting your vision and hearing screenings, exercise. You also mentioned sort of prioritizing, or maybe to me before we started speaking, prioritizing mental health and your sense of purpose.
Yeah.
But what about nutrition? Like really quickly, because I know we, you and I are ready to like
we got to do part 2
on a trip together. But nutrition, how do you, obviously like eating lots of fruits and vegetables, lean meats, nuts, all those kinds of things. But should people be having their gut biome tested? Like, is that, or looking to see if we're low in certain minerals and vitamins? Like on the nutrition front, what kind of supplements do you recommend people take to protect their brain health?
Great questions. So in general, again, nutrition and diet, so personal, no one size fits all, but a Mediterranean-based diet is...
Avoid processed foods.
Avoid super processed foods, high in extra virgin olive oil, fruits and vegetables, lots of leafy greens, fatty fish as a primary source of protein or other lean sources of protein, avoiding, the refined carbohydrates, as we mentioned already, nuts, legumes, etc. Like all those things are going to be beneficial for the brain.
And a person can test to see what they're, because I think vitamin B is important for the brain. Yes. Is vitamin D also?
Yeah.
And then what about omega-3s?
Omega-3s are super important for the brain.
So I know vitamin D is sort of on your regular physical panel, right? I don't know if B is, but can you ask your GP to add omega-3s to that, to B, or is there a special place you have to go? I mean, would people at the end of this conversation
go home and do
besides
something?
People who feel like they've gone on vacation with us because we've been talking for so long, but I want them to know sort of where they can go, right, to get some of these tests done if they want to pursue it.
You can check your omega levels yourself, which is amazing. And not only is it amazing, the test itself is more accurate than the test the doctors will check for you in general. So there's a test called Omega Quant. You could go to their website. I have like no financial disclosures or any connection to them. I just think their test is really good. You go to their website. You order it. It's about $99 or so.
Okay.
And it's a little finger prick card. They send you a card. You prick your finger.
And they'll tell you, the results will tell you. They'll say you like you're in a normal range or you're in a
it'll
optimal
tell you
range.
if you're in a normal range. And
do you want to be in like an optimal range? I know that's one of these things with doctors. They'll say, it's in a normal range, but normal isn't always optimal. So
agree.
Well, does it give you that information?
Yeah, it does. It gives you kind of a spectrum of where you are. And what this test is testing is your omega composition in your red blood cell membranes, which is more accurate than what's floating around in your blood. Testing in your actual red blood cell membranes tells us, are the omegas actually getting to the place that we want them to be?
I see. Okay.
So it's better.
And if you're not, then your supplements, besides obviously diet, like fatty fish and nuts, if you might want to look into supplements too.
Yeah.
And then maybe have it tested again in 6 months or so and see if you're improving.
It takes about 3 months for your omega composition to change in your red blood cell membrane. So in 3 months after being on a consistent dose of omegas, you can retest. But fatty fish is really the best source of omegas. We've recognized that getting our omegas from whole sources rather than supplements is better.
Also,
brain.
Walnuts.
Yes.
Are very high in omega-3s.
Yes, but harder to get omegas through plant sources.
Interesting.
Truthfully. Okay. Harder to get enough omegas. So testing to see where you are at baseline, and then, everyone asks, like, how much omegas do I need? It's so hard to tell because everyone eats a different amount of fish. For a lot of people, a supplement can be really a helpful addition, and it's extremely important for people who have this ApoE4. They seem to have reduced penetrance of a specific type of omega called DHA into their blood-brain barrier. So they may need higher doses of omegas to actually get to the brain and do all their important tasks.
Wow. Okay, what else besides omega?
We talked about B vitamins. B vitamins are...
How much should people be taking in a supplement? Or, I mean, should you be always supplementing if you're just not sure if you're getting enough? Or
I always like to test.
Okay.
You know, there are risks with anything. And for omegas, there's a risk for something called atrial fibrillation, which is an irregular heart rhythm.
Okay.
So you don't really want to be taking excess amounts of anything if you don't need to. Also, bruising, bleeding, potentially increase risk with omega. So nothing is benign. That's why it's really important to know what you particularly need.
Okay. And how do you get tested for B?
B vitamins your doctor can check for. That one's very easy. You know, the one thing about B vitamins is a lot of people know that they need to take B12. That's a big vitamin. It's important for...
There's also B1,
6, 9. Right. There's tons of B vitamins.
So which one do you take? Because
a B complex.
A B complex, all of them. Okay.
Which has the big ones for the brain are B12, folate, and B6.
Okay. I always feel like people should keep taking their prenatal vitamins. You're so covered by the...
That's true. There's a lot.
They have everything, you know?
There is. It's very easy to become toxic on some B vitamins, though, so that's actually important to know. B6 in particular, if you take too much B6, you can actually develop neuropathy or damage to the nerves in your peripheral nerves in your legs, and I've seen that happen in people who are taking really high doses. So try to stay under about 20 micrograms.
Okay. So but regardless, you want someone to get tested to have a baseline of what their omegas, their D, their B levels are. Any other minerals like magnesium? What are there other things that people should be taking as supplements to help protect their brain health?
Great question. I mean, there are lots of different supplements, and like I said, I don't like to give general like everyone should take this. Another supplement that I personally like that I think most people who have risk could benefit from.
Yes.
I wouldn't say everybody, but people who have risk, is a specific type of curcumin called theracurmin. It is it is formulated so that it can cross through the blood-brain barrier better than just curcumin.
Curcumin.
It's called therakurmin. Therakurmin, which is
therakurmin.
Yeah,
okay.
Which
Don't
is
make me say that 10 times.
Yeah.
I'm writing this down. Okay.
Which is a type of curcumin.
Okay. And you can buy this over the counter.
Yes.
This is okay.
Yeah.
And can you test your levels of this?
No, you can't.
You can't. Okay. So what would you recommend for a supplement, or
it's
would you
about
only if you
600.
have this a risk factor?
If you have risk factors and honestly evidence of inflammation, some people have elevated inflammatory markers that are detected in their blood. I would recommend being on it, because what this potentially does is reduces neuroinflammation, and it can help improve cognition in the short term as well. But long term, one major mechanism by which neurodegenerative diseases form is through excess neuroinflammation, inflammation in the central nervous system. So anything that can kind of tamper down inflammation, which this can do, is important. I mean, this goes to why things like shingles vaccine, which we didn't talk about, is really important. Get your shingles vaccine. It is associated with a lower risk of dementia in so many studies, in so many well-designed studies. And it makes complete sense because these viruses trigger tremendous amounts of neuroinflammation.
So wait a second. So people that got the vaccine are less at risk, or the people that develop shingles are more at risk?
People who got the vaccine are at a lower risk of dementia.
Wow.
Full stop. Like in multiple studies.
Interesting.
And there actually was a recent study that showed that they were at a lower risk of cardiovascular disease. I think this came out like literally last week.
Wow.
So
hot off the press, people.
Yeah, hot off the press.
Okay, so get your shingles vaccine.
After the age of 50.
Have your omegas, Bs, Ds tested. Make sure that you're at optimal levels there. Sleep, exercise, nutrition, hearing and vision screenings, manage your stress. And managing your stress might involve going on an SSRI, right? Seeing a mental. If you're depressed, you need to. It has physical effects, right?
Absolutely.
And it can affect your brain health.
Wearing a helmet and seatbelt. Don't forget that one.
Helmet and seatbelt. Okay. And we talked about my friend who's also your patient. And just for listeners, this is someone whose father died of dementia and was genetically tested. She had the 4. I call them 3-4-2 as opposed to
3-4, ApoE 3-4.
ApoE 3-4. And she went and saw you because she was very interested in being proactive here, right?
And she was having symptoms.
And was symptomatic, yes.
She started to have concerning word-finding difficulty, which is something that her father also developed.
Interesting. And then, so that's when she reached out to you. And then you tested her blood for these biomarkers, those proteins that we mentioned. She was very disciplined and took action right away and changed her diet, started taking supplements, and started exercising and focusing on developing muscle mass.
Yep.
And she has now is no longer symptomatic, right? For some of those having trouble searching for words, doesn't have that problem anymore. And those proteins that we talked about have declined.
Yeah. And whether that will translate, and I'm hopeful, this is what our research is doing. I don't ever want to.
Because she's part of one of your research studies, right? Tell us a little bit about that, because I know you both, CNN covered this story and interviewed her for a piece about the work that you're doing and her being part of that research study.
This is such an important, and as I mentioned, so it will help push the field forward. I truly believe that. I'm of course biased, but testing for these proteins in the blood, yes, can be incredible diagnostic tools, but more importantly, they can potentially help us monitor the efficacy of the treatments we're offering patients and really be able to provide personalized care. But the question is, how do these biomarkers change over time? What is considered, normal preclinical and actual disease, meaning, someone who doesn't meet the clinical criteria but may have abnormal biomarkers. Like, how do we define all these things, and how do we follow these, and what biomarkers do we follow longitudinally? That's part of what we're trying to study. And we did present some preliminary research at the American Academy of Neurology meeting, which was in April of this year. And we did show that these biomarkers can change, and we've identified some very interesting potential outcome measures to use for our next larger trial, which will really be powered better to test some of these impacts. For example, hormone replacement therapy in perimenopausal women. How does that impact blood-based biomarkers? How do these GLP-1 agonists impact biomarkers in very specific at-risk patients? So we'll have more information.
Well, it's interesting to me when you were saying that women are at higher risk than men. There has to be some hormonal, again, I'm not a doctor or a researcher, but it would just sort of, stands to reason that there is some relationship between the two.
There's so much we don't know, because on the contrary, men are at a higher risk for Parkinson's disease.
Oh,
so
interesting.
The impact of biological sex is fascinating and poorly understood.
Okay. Well, again, you and I could go on a cruise together. I have so many, this is definitely probably going to be a two-parter here, because we covered so much, but I just think it's so impactful and so empowering for people. I know it is for me, talking with you, to know what I can do to help, hopefully prevent the onset of some of these disorders for me or for those who are listening, whether you're at risk genetically or not. It's really exciting research and such important work that you're doing. And I just can't wait to see what's next.
Yeah. Thank you so much.
Thank you so much. It was such a pleasure.
Great. Thanks so much for having me, Leslie. This was so important, and I'm so glad that we got to cover this topic. So many people need to hear this.
Oh, and where can people, if they want to find you, where is you're practicing in New York? I know you're also in Florida.
My practice is in New York. I'm in Manhattan. Visit me at my website. You could just Google my name. You'll see it. But
perfect.
It's drkellyanniotis.com.
Okay. Thank you so much, Dr. Niotis. Thank you so much.
Thank you.
That brings us to the end of this episode of the interview. A huge thank you to Dr. Niotis for joining. And as always, thank you all for listening. I'd like to also thank our sponsor, 10-Mile Distillery. Don't forget, if you visit their website and www.10miledistillery.com/the-interview, you put in that interview promo code, you'll get 10% off of your order of their award-winning Little Rest whiskey or any of their other spirits. It's an offer you do not want to miss. And thank you all, listeners, for joining. If you enjoyed this episode, please rate and review us on Apple Podcasts or Spotify or wherever you get your podcasts. We'll release a new episode on a different topic next week. And until then, this is Leslie, and thanks so much for joining the interview.